Great. Hello everyone, good afternoon. A very warm welcome. I hope that you're in the right place. This is SCVO, SCDC and Public Health Scotland's event about reopening your services and restarting face-to-face activity. So we're absolutely delighted. I in particular actually am completely delighted that we're able to run this session today. And we're kind of coming out of the end of a long winter with the lockdown and all the hardships that's entailed. And beginning to think about how we get back to some of the activities that we know work best when they're done face to face, and some of that social interaction and so on. We also know, however, though, that the voluntary sector has been mostly closed except for essential services, so we've not experienced any kind of outbreaks or big COVID outbreaks that we know about. But there's the potential for that as we begin to reopen, and we know that everyone is concerned about doing it in the safest way possible. And also that there's quite a range of guidance and information out there, so you want to have access to the best stuff. So my name is Beth McCushy. I lead support services here at SCVO, and we've got a packed agenda with some real experts available today to hopefully give some reassurance and point people in the right direction of resources that can help with the really practical stuff around risk assessments and occupancy and space and so on. We were going to do this as an interactive session, but we've been overwhelmed with the response, which is lovely. We've had about 170 sign-ups. So it'll be a webinar. That means you'll be able to see us as we're talking to you, but unfortunately we'll not be able to see you. So if you're still in your jammies, it's okay. It does mean that you won't be able to talk to us though, so we'll be making use of the chat function and the Q&A function, and we're also recording the session today, so if you want to watch it back or if you want to share it with others, then that will be available on the SCVO YouTube channel, and as you would expect, we'll also send out any resources following the event to people who've attended or registered, so PDFs of slides and things like that will be made available as well. I think that's the housekeeping for me. I'll pop on again towards the end just to tell you a little bit about the SCVO Coronavirus Information Hub, and we'll mention that throughout the time as well and some of the support that's there. But before I hand over to Lisa McCann, who's our expert from environmental health, who's going to take us through some opening remarks, we're going to do a quick poll, if that's okay. So Helen, can you pop that up? So if I can get you to fill in the poll and tell us a little bit about your readiness for starting back, that would be great. That's just been filled in just now. Brilliant. And if we can end that poll, Helen, that'd be brilliant. Okay, so just to get a sense of kind of where people are at, so there's a mixture here. Almost half of you no current plans to start back, and sort of a mixture of, about 19% have already, and a few who are thinking May or June. And then, do you feel ready to do this safely? A high percentage there are not sure. So I hope that by the end of today's session we can have changed that a little bit and have given you some information to feel more reassured. So that's great. Thanks very much. We can close that poll down now. And I'm going to hand over to, sorry, I've just seen in the chat that there's some difficulty hearing. If that's common to other people, please pop in the chat and we'll try and do something about that. But I'll hand over now to Lisa McCann, who's going to take us through from an environmental health perspective some of the key messages.
Okay, thank you, Beth, and hopefully you can all hear me okay. So thank you to the SCVO, SCDC and Public Health Scotland for inviting me along to speak to you today. So as I was introduced, my name is Lisa McCann and I'm here to talk to you about restarting your services from an environmental health point of view. So before I get into my whistle-stop tour of what my view as an environmental health officer that I think you should think about, just thought I'd give you a little bit of background information about myself. So I'm a chartered environmental health officer. I currently work for Fife Council, predominantly before the pandemic in the food and workplace safety side of environmental health. I'm also involved in our professional body for environmental health, the Royal Environmental Health Institute of Scotland. And over the past year, I've worked mainly in regards to COVID with colleagues in environmental health and trade and standards from across Scotland, along with various partner organisations. So hopefully I can give you some of my learning from the past year to help you on your journey to restarting your services. So as we heard Beth say, there is a lot of challenges, or there can be a feeling of what am I meant to do for restarting my services. There's been a lot of changes over the past year, not to mention in types of levels of restrictions, whether it's been Scotland-wide or more regional or localised. There's also been many, many changes in legislation. The current set of coronavirus regulations that we're working to came in about September, October time, and we're already on amendment number 20 odd. And the guidance changes more often than that. So as environmental health and trading standards professionals, it's taking us to keep up to date. So I can completely understand why organisations and businesses out there are finding it difficult to keep up with all the changes. And a lot of the questions that we get and get asked about for advice are, I've listed them here on my slides. What am I allowed to do? What activities are permitted and when, and where can I get advice? So in terms of what's allowed and what's when, the best thing to do is look at the Scottish Government's route map, and we'll know as we're moving down the stages. And we obviously got a big update yesterday from the First Minister, and the majority of mainland Scotland is due to move to level 2 in the route map from Monday, with the islands moving to level 1. We only have one local authority area who is potentially staying at the level that they're at. That information is all on the Scottish Government website. And that's also one of the main sources of information for advice. I'd also give you, as I go on, other sources of advice. But the main ones is your big agencies, your local authorities, HSE, Food Standards Scotland, and of course, Public Health Scotland, the SCVO and SCDC.
Lisa, can I just interrupt you very briefly? A few folk are struggling to hear you, so can I get you just to talk up a wee bit, if that's okay?
Okay, I can talk up a wee bit, or would you like me to try headphones? I can do that as well.
Got some handy, that might be worth doing, yeah, if that's okay. Sorry, we're best to get the best sound we can.
Okay, not a problem. I'm used to using Teams rather than so.
Talk amongst yourselves. We'll just be a wee second.
The joys of virtual working.
Indeed, indeed.
Hello, is that much better?
That seems much better for me. If folk want to pop in the chat if they're still having a problem, but that sounds much better to me. Thanks very much.
Okay, not a problem. Yeah, better to tell me that rather than not hear what I'm talking about. So where was I? So for me, if I was speaking to a business today on a one-to-one capacity, having a phone call with them, what would I do? I would actually go where to start for restart. And for me, I'd be asking the basic questions of where, who, and what. So where are your activities going to occur? Are they going to be in a fixed premises or a fixed outdoor site? And if you're thinking about indoors versus outdoors, so you've got to have different things to think about. Also, is it your own premises or are you a tenant? So if it's your own premises, you know everything is going to be more under your own control. And if you're a tenant, you may need to speak to your landlord or factoring agent. Other thing to think about, and from the poll, it's probably most of you have potentially been closed up over the past year. So you've got to think about, how am I going to actually reopen a premises or service from a prolonged closure? So that's the point of thinking about any maintenance checks. That will include the building, perimeter area, outside yards, equipment and utilities. Thinking about what types of changes you might have to make to look at the current recommendations for mitigation measures in terms of COVID, so layout, ventilation, thinking about your capacity and cleaning. Next thing to think about is who. So that would be anybody who's affected by your activities. So I would say think about staff, volunteers, service users, customers, contractors, visitors, anybody that could be impacted. Then think about what communications you'll need with each group. And what about your test and protect records that you'll need for each? Excuse me. And then think about what type of activities you're going to be, and think about what they are. Are they going to be mainly static, like mostly seated, or are they going to be more dynamic and active, thinking things like toddlers groups, exercise classes, and no doubt you'll have everything in between. So I'm going to quickly run through a series of top tips for anybody restarting. So this could be for people like yourselves in the community-based and voluntary sector, or it could be for SMEs. Same principles apply. So it's thinking about your employees, your volunteers, and your risk assessment is the first step. So engage with your staff and volunteers. And these are going to be the main people that are going to give you the insight into the information you need to do your risk assessment. And I know some of you, depending on any experience of dealing with risk assessments, you might be new to risk assessment. So briefly, how I would explain it to anyone who was brand new to risk assessment, I would get them to think about and identify what causes the harm, their hazard, how likely or how frequent is that hazard going to cause harm, that gives you the risk, and then identifying who could be harmed by it. Then go on to identify what you can do to remove or reduce the risk as far as you can. That gives you your controls. How would you monitor these controls to see that they're working? And that would give you your records of your checks and any corrective action you've got to do. Next step was to make sure anybody involved in any of your activities is clear on what they need to do themselves and any policies or procedures that you've got in place. Now that will include your normal work activities plus any additional for COVID. Then also I would think about if you've got people travelling to and from, I'm going to say workplace for the lack of a better description, or place where your activity is, think about how they're going to do that. At the moment, in terms of COVID controls, we're trying to discourage car sharing out with households. So think about that, and if you can't eliminate car sharing, make sure it's consistent people. So so think about how you would pair people up or group people so it was consistent in a cohort. This will also help with your test and protect records. So I would think about test and protect records for staff and volunteers, any service users, or any visitors. So you can use staff scheduling for that record. You can use booking sheets. You can also think about things like the Check in Scotland app, which is produced by Scottish Government. Premises can register to use it, and then it's a QR code. And people can use it, but have a backup because not everybody has a smart a phone, so you will need to make sure you can keep paper records, and the minimum you should be looking to take is name, phone number, and an email address if you can, because that makes it easier for contact tracers at Test and Protect. Next top tip is thinking about your utility services and maintenance. So do you need any checks done on your gas, electricity, water supplies? Do you need any equipment tested? And think about, if you have been closed up, has there been a chance that you've had stagnant water in systems? And if that's the case, I would really recommend that you look at the HSE's website and look at their coronavirus pages, and then the pages linked to Legionella risk during coronavirus, and that will give you some good information on what you need to do and what you need to think about. And then think about, is there any bits of equipment or fixtures that maybe missed its routine inspection, such as passenger lifts. This will vary depending on what your type of service is. You may have already gone in to do maintenance checks while you've been closed, but if you haven't, that's things to think about. Next big thing to think about would be ventilation. So along with the other measures such as physical distancing, hand hygiene, testing and isolation, it's one of the measures to help prevent the spread of coronavirus. So think about, in your workplace particularly, more appropriate to indoor spaces, how you can improve and increase the ventilation as much as you can, either naturally or mechanically, or can be a combination of both. It will all depend on what your building has. The other thing to think about, if you've got any poorly ventilated areas that you might not want to have regular work in, or you might have to operate a one-in, one-out system. Again, that's going to be individual to your premises and something to think about as you plan for reopening. The next tip I was just going to highlight is the need for hand hygiene and cleaning. So think about where you stay. You have opportunity for people to wash their hands with good old-fashioned soap and water, and where do you need to supplement this with alcohol-based, hand-based stations. Definitely only I would think about it at entrances and exits and other points like reception desks, but think about your area, your activities, and think about where best to put this in. WHO recommends minimum alcohol-based hand gel of 60%, though I know NHS, when we've been doing case follow-ups, have been looking for 70%. Then when you think about your cleaning, think about what did you do beforehand, how can I improve, what do I need to increase, what other areas do I maybe need to capture, think about the chemicals, are they known or to be effective against coronavirus, and think about, as I say, all the frequent touch points. And what we've found through investigating positive cases is things you need to remember, things like kettles, fridge handles, shared PCs, phones, keypads, and these are all the sort of things that should need to be captured in your cleaning policy. And things like if somebody's got a PC workstation, my recommendation is everybody would clean it down before and after use, so everyone has a little bit of control in themselves. So depending on your activities and your usage levels will depend on how frequent that you need to think about cleaning. And then the last area I want to talk about is preparation for physical distancing. So most areas will be working on a 2 metre based physical distancing. So unless it's purely hospitality where you have the option of looking for 1 metre, most places you'll be looking at a 2 metre distance. So you need to know what your COVID capacity is. And as of next Monday the 17th, we'll be looking for you to have a signage with that displayed. You may need to do multiple calculations depending if you've got different activities and different setups. But the basic way to do it, and I know people, my fellow panelists will be discussing this more a bit later, is you need to work out your free space and then work out the how many people you can then safely get in that free space that you have within your business. And depending on your layout, depending on your usage, you can think about things like marking on the floor. Can your layout support a one-way system? And if you've got pinch points and things like that where you have potential to get congestion, recommendation that's a good point for signage to remember to customers and staff. Other things you can think about is physical screening. And you can see that quite common now at till areas and at reception desks. Other things to think about, do you have options to stagger start times and finish times? Will all be very unique to your own setup. These are just things to hopefully help you on the way to the journey to reopening. That was a really whistle-stop tour of what to think about for restarting, and hopefully it gives you some food for thought and where to look for. There is lots of information out here, and as Beth said, I think you will be getting a PDF version of these slides, so you will have these links. But the most common places that would direct business to would be the Scottish Government website, the Health and Safety Executive website, particularly their coronavirus pages, the same for Food Standards Scotland. You've got Check in Scotland for the app for Test and Protect, and then of course you've got the SCVO and the SCDC pages, and hopefully you'll hear more about them as we go through the event. So thank you everybody for listening to my whistle-stop tour of what to do.
Great, thank you so much, Lisa. That was really, really helpful, and hopefully people have got those kind of, those top tips. And as you say, we're going to go into more of the detail of some of those as we get going. And I've seen some questions starting to come through in the chat. So I'd encourage you to, if you think of things as we're talking, please do keep your questions coming. We've got people monitoring the chat, or if you'd rather pop them in the Q&A function, that's completely fine as well. So what we were hoping to do now is to move into kind of a question and answer session. Loads of you submitted questions ahead of time, which was brilliant, and we've tried to group them into kind of the broad themes, and I'm going to hand over to Lisa Martin from Public Health Scotland, who is going to take us through the Q&A section. So over to you, Lisa.
Thanks, Beth. Can I just check you guys can hear me okay? My sound was a little bit low earlier. I just want to be sure.
That sounds fine to me, yeah. If people want to pop in the chat if they can't, but yeah, it sounds good to me. Thanks.
No, that's grand, that's grand. So yeah, absolutely. My name's Lisa Martin, I work for Public Health Scotland. Thanks to everybody who submitted questions in advance. Of the real diversity, real range of issues that came through. We're lucky enough that Lisa McCann is going to be able to stay with us for the next sort of 35-40 minutes or so. So hopefully we'll be able to make the very best use of her expertise and knowledge whilst we have her with us. What I would also say is that we have tried to group the questions together into sort of the main themes, just to try and address as many of the kind of points and issues that you raised and the questions that you did submit. We won't have time probably to get to all of them, but I would certainly signpost you as well to the Supporting Communities Safely resource. There's a lot of really relevant content, especially in the new pages. So if you don't hear your particular question or point coming up, please look there. As a kind of first point of contact. And also there is a contact forum in the Supporting Communities Safely resource. If people have something very specific or they're just still not quite sure about something, they can use that to get in touch with us, and we'll try our very best to get back with anything specific. So there's a number of routes that folk can go to get some kind of questions and queries answered. But I'll start off with the first question. What we might hear as we go through is, some of this information we've already shared. We might be repeating some of these messages, but, absolutely, I think that's a positive thing. There's certainly no harm in hearing some of these really important key messages, maybe one or two times. So the first question was around risk assessment, and we know Lisa's just covered that in her presentation, so I'll come back to Lisa if that's okay, maybe for a wee bit more detail around that. But we want to reopen, but we're not sure how to put a risk assessment in place. What do we need to do? So it's maybe thinking about some of the things around who's responsible for risk assessments in a group or a facility, and maybe just again reinforcing some of those key things that people ought to cover, and maybe some signposting as well for where else they can go for support. That might be something, Beth, that you would be able to add in around what's on the SCVO website. Oh, I think you might still be on mute, Lisa.
Yep, somebody always does that, doesn't they? So yeah, in terms of risk assessment, so if it's basically the group will need to look at their own activity. If they are using a rented space or they're sharing a space with somebody else, they'll need to have a conversation with the landlord or manager of the facility, or maybe the manager of the other group, just to make sure that nobody's activities is adversely impinging on anybody else. Also, if it is a rented space, it's good to know if there's a manager on site, what is their responsibilities? Are they going to be, and what are they going to do? So maybe less controls. But as I was saying in my presentation, is look at what your activities are, find out what are the hazards from your activity, what could potentially harm somebody, who could potentially be harmed, and what can I do to reduce or eliminate that risk as much as possible, and then note it all down. So I do know the websites that have been mentioned, SCVO and SCDC have information as well. Also, the HSE have a guide on how to do risk assessments. So I would look to go there. There is, and it is just a matter of looking at all those things. What's the activities? What can harm us? How frequently could that potentially happen? How can I control it? How am I going to monitor it? And then periodically reviewing it. What I would say is for anybody going back and restarting, hopefully they'll have risk assessments if they had previous activities, so they maybe not starting from scratch, so they might just need to review it, thinking about what additional risks and hazards are presented by coronavirus. So it would maybe just be a matter of reviewing it in terms of that. But best thing to do is, if not sure if something's going to work, trial it, test it, go back and then go in. But definitely get the people who are going to be involved in the activity involved, because they're the ones that are going to have the practical solutions in mind. So hopefully that helps.
Thank you, Lisa. Thanks very much for that. I just wanted to open that up to maybe to Mick or Beth, if you wanted to add any additional comments or points around that question.
I think we've covered most of the detail. I think maybe just in terms of the resources available, a lot of the links that Lisa's referred to, we've pulled them together in our resource so that they're in a single place and they're accompanied by sort of diagrams and, you know, sort of points of accessing the material that might work well for you as volunteers or management committees or staff, but some of them might work quite well in explaining the issues to people who use your services as well. I think a real issue about this is to make the identification and thinking and management of risk something that's everybody's responsibility. Some of us are responsible for doing the work and producing the documentation and monitoring the outcomes, but really to manage the risk properly, we need to try and get as more people involved as we can. So that's what we've tried to do, is to make the material as user-friendly as we can. We'll talk a wee bit about that when we do the presentation later.
That's great, Mick. Thanks very much. And yeah, absolutely. We're going to cover that in a little bit more detail when we look at the supporting community safely pages in the presentation. So I'll just move on to the second question. And again, we've touched on that, and Lisa's touched on that in her slides. But it is something that came through as probably the most prominent question that we got from folk submitted. The biggest worry we have is how to manage physical distancing inside our buildings safely. What are the key things that we need to think about? And I'm aware that we are going to touch on that. Mick and myself are going to pick up on that in a bit more detail in our slides. But if I could maybe just come back to Lisa, if there's anything from her perspective, from an environmental health perspective, that she wanted to add in.
Okay, apologies, my phone had went there, so apologies. Is that to do with risk assessment again, or physical spacing? Sorry.
It was about physical spacing and just some of the, again, reinforcing some of those key messages, some of those key points that people have to think about.
Okay, thank you for that, and I'll make sure my phone is put on silent going forward. So best thing to do for looking at physical distancing is, one, think about your premises, think about working out what your free space is, and then going back and then working about what is my capacity. So it's a lot about going back to basics, and I know the information on the website, Mick was talking about the website for the SDDC has a lot of information, particularly on the new pages, on how to maybe do that practically. So it is about, if it was me, and some of the examples I've started to see coming through in the day job have been people just making a plan and working out what their free space is. So it is getting a measuring tape out and working it out. And some things we have done where it's maybe been more on the hospitality side, obviously they can work on the 1 metre rather than the 2, but they've worked out the number of people and they've only kept that number of seats. So it's how to make it as easy enough for yourself to control about it. The other thing to think about is if you've got different activities, you might just need to work it out a couple of different times to think about the best way to do it. Because what I would say is, if somebody's going to be more active and more running around, if it's a fitness class or something like that, you might want to give them a little bit more room for that than maybe a more sedate, I'm sitting down most of the time activity. So again, it's more about thinking about your space and how best you can work it out, and then having a plan and keeping it so people who are maybe setting up your facilities for different activities have an easy reference guide to do it in. So I hope that helps.
Thanks, Beth. We are going to pick up on physical distancing in particular because it forms quite a big part of the new content that we've added to the Supporting Community Safely pages. And Mick's going to speak a little bit about that. But was there anything at this point, Mick, you wanted to add to Lisa's comments?
I think the only thing I would say is that, and this is like a kind of touchstone for what we'll say later on. Up until now, we've all emphasised the importance of folks staying 2 metres apart, but I think it's much more recently that we've actually started to think about what that means in practice in terms of how many folk can you fit in a space, and in particular, how do you explain that to people that have never done that kind of calculation before. And we've been very fortunate to work with the Institute of Place Management, who helped us to think about this issue of how much space you need when you're sitting about and how much space you need when you're moving about. And we've shared that in our documents, but it's not the only analysis of those issues. And there are others around. And, even just in the run into the session before we started there, I got an email saying that Scottish Government are looking to try and rethink their guidance on this. So what I would say is, look at our material, but keep an eye on the material, because it might change again. And the thing we are trying to do is to create a tool that would allow you to put in the area of your building, and it will tell you how many people can get in dynamic space and static space, just to make that easier for you. And for me, when I thought about area, I thought, well, football shots were longer when I was at school, and I had to think about how to calculate that. And in a way, that's what we've done with the resource. We've tried to take people through the straightforward ways of understanding what you need to do. So it's an evolving science, but it's important that you understand a wee bit of the science and you have the tools to make the right judgment. So it'd be good to say that now, I think, because it frames everything else we'll talk about later.
Thanks, Mick. That's really helpful. Thank you. I'll move on to the next question. In fact, I think probably just in that same vein that we are going to pick up on this in a bit more detail in the later presentation. What I might do is I might just hold back on this question. This question is about ventilation. The question was that it's someone who rents their space from someone else, and they're not sure what type of ventilation system they have in that space and what do they need to do next to be able to use that space safely. We are going to pick up on that in a bit more detail later. So I think maybe just given that we want to keep Lisa with us for as long as possible and get through some of the other questions, we'll skip over that. And if there is anything that we don't cover, then come back to it when we talk about it in the presentation. Come back, post something in the chat, post any comments that you've got on the ventilation question. But we'll come back to that one when we get to the presentations. So if it's okay, I'll just move on to the next question, which, and I also see someone's posted about this in the chat, which is about guidance, and it's about the range of guidance that we have and how do people work out what guidance applies to them and to their particular activities. From my own perspective, I would just, absolutely acknowledge that, it is very confusing for people, and it has been, there's been at one point at the start of the pandemic, there was really not very much guidance around, particularly for community and third sector organisations. And then there has been a real raft of guidance, which has, is essential and in ways is very, very helpful, but trying to navigate your way to the bit that is right for you can be a real challenge. And that's one of the things that we've tried to do in the support and community safely pages. We've tried to help people to get to the information that is right for them, that they can use to make informed decisions about how and when they reopen their services. But I'll maybe ask Mick if you wouldn't mind maybe just jumping in to say something about a couple of the particular bits of guidance that are relevant for our sector, the community and third sector, rather than the more general guidance that's around. Oh, you're on mute, Mick.
Sorry, I'll just try and briefly touch on a couple that are relevant to the community kind of context. One is the community learning and development guidance, which is quite a comprehensive document that talks about what are described as community learning and development settings, which is quite a broad description, but not everybody sees themselves as fitting under that description. But it talks about people who are involved in working with young people, who are involved in promoting learning of some kind, or who are supporting kind of some types of community development. So that's important. And what's important about that particular piece of guidance is it recommends maximum numbers for certain types of activities, mainly in the adult learning and youth work sphere, and of people of particular ages. It doesn't go into detail about how you calculate making that fit a space, and hopefully you can use it alongside other guidance to be able to do that, and with the other government guidance that's coming. So that's, if you think of yourself as being part of community development, learning and development settings, that's a very useful bit of guidance. The other one is the guidance for people running community facilities, which is really around what needs to be done by people running community hubs, community centres, and various other types of, I suppose, community facilities that maybe don't associate with the CLT tag quite so readily, although there's a big overlap, and it gives lots of advice on starting back. They all signpost you to similar sources of support, and I would emphasise that to Rose who's put a comment in the chat, that there are sources of support there. And if you can get in quite quickly, environmental health teams, health protection teams, our own resource, because there is a query box to raise issues, we can try to give people what help we can. But our resource is designed to try and be a straightforward way of finding your way through. What's come out recently and is now about to be updated is guidance on capacity calculations, so how many folk can use a space. And that has been much more difficult, and that's what we've tried to do in our new material, but it's part of a bigger debate. And all I can really say is watch our resource and other places to see how people are doing the calculation, but we'll show you a way that you can do it, which is credible. Always go for the result that provides the greatest safety, I would say. Go for the result that has the fewest people until you're sure that you can increase that. Would be a good rule of thumb. I'll leave it at that.
That's great, Mick, thanks. And it'll be really good to be able to walk people through some of those steps a little bit later on. I just wondered quickly if, Beth, there was maybe something you wanted to add around that in relation to what SCVO is providing in terms of information and signposting and so on.
Yeah, absolutely. I'd be happy to, Lisa. So, I mean, I suppose I'm echoing what everyone else has said, that it's a complicated picture, and we know that it is. And I don't know that there is an easy solution, because things are changing so quickly, because we've got the different level systems. So there is a bit of a regional thing to it, because our sector is diverse. So some people might be running a charity shop, they should be looking at the retail guidance. Some people might run a cafe and they should be looking at the hospitality guidance. So it has been complicated, and it's been complicated for us to try and collate some of that and make it available. So in my view, this is a personal view, but in my view, the resource that Mick has mentioned, the SCDC resource, is the best place to get all of the stuff that's relevant to providing community-based, voluntary activity. And if you follow that, you'll be keeping aligned with all of the bits of Scottish Government guidance as well, because it's taken account of all of them. So part of today's event was really to highlight that that's there and that it's been updated, and we think it's really good. If you are out with that if you don't see yourself as sort of community activity, then the Coronavirus Info Hub on our website has got links to all the other bits of sector guidance that we think are relevant to the sector. So I know it's difficult, and when we had these events with Jason Leach earlier on in the year, he kind of was at the point of saying you sort of had to do the hard work, which isn't ideal, it's not great, and there is shared learning, but unfortunately you are going to have to find a bit of guidance that feels like it fits what you do the closest that you can, and then go with that. But actually, the messaging in all of them is pretty much what Lisa McCann was saying at the start, with a few variants. So if you're following the physical distancing, the hygiene, proper risk assessments, occupancy, good ventilation, if you're doing all of that stuff, you're pretty well going to be aligned with the guidance. It's the same sort of stuff that's in all of them, with a few tweaks, would be my view on it. So yeah, I think just acknowledging it's not straightforward for folk, but hopefully there is enough out there now that you can pick something and go with it. And as I said, the SCDC, it's dead practical. There's a lot in it, but it's very, very practical. So yeah, do take a look.
That's grand, thank you, Beth. The next question is kind of connected to that, and it does kind of follow on from that. There was a question around about a specific activity, but it links to that more general point about where do you find the information about what activities are permitted. In the example, the specific activity was is singing permitted if it's a pre-5 group and it's outdoors. And I'm happy to answer that one. In that case, for that particular example, for a pre-5 group that is meeting outdoors, is singing permitted? The answer is yes, singing is permitted. So that's a kind of straightforward short answer. But you're absolutely right. It's not always easy to find your way to the type of information that you need. And it's also important to absolutely recognise that not every single specific activity has got guidance that has been written particularly for that. So as Beth just mentioned, it very much is a case of trying to find either your activity or a comparable closest activity, and using that to sort of base your decision making on. In the case of singing, there is a particular piece of guidance, and that's because there is some question around about whether there's any increased risk with singing, with aerosol transmission in the environment and people being in close proximity, etc., to each other's. So for that particular one, there is specific guidance, so it's relatively easy to signpost people to that. But just more generally, if people want to try and identify particular activities and find out what's permitted at different levels, the starting point, I would say, would be the main Scottish Government COVID pages. And I think we can pop a link to that in the chat box if we haven't already done it. When you get onto that page, there is a pull down menu that says what you can and cannot do. And that's for all the different levels from 4 all the way down to 0. And that's where you identify your activity or situation that's closest for you. So in the example for singing, there is a drop down menu that says, are you an unregulated children's activity? For a pre-5 group, that would be the closest match that you could possibly get. So you would then go into that section. It would take you to some guidance and you'd be able to see quite clearly that they've got a little bit in there that talks about drama and music and play. And they say that singing is permitted in these circumstances outdoors, but not yet indoors. So we have touched on this on previous questions, but it's really just to say that in our pages on the Support and Community Safely resource, as Beth just pointed out, we do signpost people to these different links. We also give people some practical advice about how to apply sort of sensible judgment around how you make decisions, but it's always set against the framework of the guidance that exists, the formal government guidance, because that's all about reducing infection transmission and keeping people safe. Just before I move on to the next question, do either Lisa or Mick want to say anything in addition to that in relation to the guidance and how you find your way to it? Okay, we'll just move on. Okay, the next question is about transport. Our project uses community transport minibuses to get people backwards and forwards. How do we do this within the guidelines of physical distancing? Again, this is one that I could probably pick up. Minibuses and car sharing schemes, volunteer schemes, etc., are covered by the general guidance on travel and transport. So they're not classed as public transport, they're actually classed as private vehicles. So at the moment where we are within level 3, for private vehicles, which includes minibuses, which includes volunteer car sharing schemes, etc., the restrictions say that that should still only happen for essential journeys only. So essential journeys in this situation would be for things like if you're working with very vulnerable people, if you're working with people who have got additional support needs, or if it's people who rely on private transport for essential activities, things like food shopping or getting backwards and forwards to medical and hospital appointments, that type of activity. So what I would say, and I'm sure Lisa can add to this, is that it's probably down to your individual project or service to identify whether or not the people that you're working with and the people that you're supporting fall within that essential services category. If the answer is no, then I think what we're saying is that you have to wait a bit longer. It's not something that you can do just yet, and we need to wait and see over the coming weeks whether the restrictions around that ease off a little bit. But if you can kind of confidently say yes, that the people you are working with fall within that essential category, they are particularly vulnerable groups, or people with additional support needs, etc., then what I would say is a starting point would be to look at the pages on our Support and Community Safely resource that Beth's already mentioned and that the link's been posted to in the chat box. It's got some really good basic information there about how you use vehicles, some guidance around physical distancing, how you would manage that for vehicles, both when you're using the vehicle, but also to and from vehicles. And it also has some information about cleaning vehicles from a cleaning and disinfection point of view. Maybe another couple of links that I'd signpost people to, which I thought were particularly good, were on the Health and Safety Executive website. They have a page that is specifically about physical distancing in relation to vehicles, and that includes minibuses. And they also have other pages as well on cleaning. They're almost similar information to what we've got on the Support and Community Safely resource. Probably the other one that I would signpost people to would be the Community Transport Association UK website. And again, I think we could maybe post a link to that in the chat box. They are a national organisation, but they have got advice and they link to the different parts of the UK, so you can have a look at what's relevant to Scotland. But what they do have is they have a number of kind of quite generic kind of fact sheets with lots of hints and tips for people who are in particularly using minibuses as part of their services. And there was one in particular, there's a case study on the Community Transport Association website. It's from, I think it's a care provider, I think they're called the Redbourne Care Group. And I certainly, when I looked at it, thought that it was very, very helpful. What they've done is they've produced a bit of a case study. They've got a checklist. They've kind of put in place a kind of very practical operational policy of how they are managing the use of their minibuses. And what they've done is they've really kind of shown their working in the margin, if you like. They've explained how they've arrived at the decisions that they've made. They talk about things like working out the capacity of your minibus based on the size of it, using screens to separate the driver from the passengers, about creating transport bubbles or travel bubbles for groups of people, so that it's the same groups of people and staff that are moving backwards and forwards in the buses at any one time with no trips in between, etc. So that's certainly another link that I would signpost people to that's definitely worth looking at. That's the Community Transport Association one. Lisa, is there anything in relation to that you would maybe want to add?
I think, no, Lisa, you've covered it very, very well. But if you can, and you have drivers who are able to drive larger vehicles, and you can, a practical thing to think about in addition to all that you've said, and it will be in that guidance, is if you have a larger vehicle, you can actually separate and have physical distancing within the vehicle, along with the windows opening and the cleaning and things like that. So sometimes it's about just leading the guidance and taking a step back and actually thinking practically, what's the simple solution that is its meaning here. So instead of having a car for a couple of picking up a couple of people, can I have them in? Do I have a driver that is licensed for a minibus, and then I can have them physically distanced?
That's grand, thank you. Okay, just on to the next question, which is that we run activity groups for people with dementia. Many don't have capacity, so things like physical and social distancing, face masks and so on are going to be difficult. What does the current guidance say about this for indoors, for moving indoors? Again, I'm happy to just jump in here. It's not a straightforward answer, I'm afraid. I guess the short answer is that the guidance at the moment and the restrictions say that unless you're providing what is classed as an essential service, there really isn't any exception to the current physical distancing requirements. That's set out in the guidance for non-healthcare settings. You can find that on the NHS Inform website, but again, we might be able to pop that into the chat box if anybody wanted to look at it. But what it says is that where 2 metre distancing can't be maintained, it's only essential activity that is permitted to happen. So it's back to that question, I guess, about what is essential, what's classed as essential activity, and the guidance does give some examples that you could maybe use for comparison against the type of thing that you're providing. It says that essential services are those that would be classed as critical to the physical and mental well-being of someone, and that the removal of those services would put the person at risk of harm. The examples that they give are things like therapy and counselling sessions, bereavement support, support for carers, alcohol and drug services, and similar types of things. And that applies across all the protection levels at the moment. That's from the level 4 all the way down to 0. There's different guidance for social care providers. So if you are, part of a health and social care partnership, or you're providing something that's classed as social care, maybe through a commissioned arrangement, there's separate guidance. This is the guidance that applies in non-healthcare settings, and that would typically be what we would find in community and third sector settings. So what I would say is that realistically, there will probably be very few community-based activities for people in this vulnerable group that would fall within the definition of essential services. So the message is probably going to be not yet. But as Lisa mentioned earlier on, the First Minister's briefing yesterday, she talked about the relaxing of physical distancing in people's private residences and in their homes from next Monday. And she did indicate that physical distancing more generally was something that they were going to be looking at in the coming weeks. So I mean, I definitely think there's some optimism there, but it's a case of waiting to see what emerges over the next few weeks to see whether those restrictions change or not. Is there anything, Lisa, that you would maybe want to add to that, or have we covered the kind of main points there?
I think you've more than covered the main points, but what people can do is start thinking ahead, because if depending where they are on their journey and what activities they're doing, if they're not quite at the level for reopening this month, maybe when we get down to level 1 or level 0, it maybe gives people a bit more time to think about it. So time to go and have a look at the guidance and time to think about it and plan in. So that's what I would advise, is if you've got the time, think about it as a committee or as the appropriate persons in the organisations, so you can plan it and then get ready to test and try things out as soon as you're ready to restart.
That's grand, thank you. Okay, just picking up another question. This came up through when people submitted questions in advance, but I see that it's came up a few times in the chat box as well, which is that many of our staff are still working at home. Is there any indication on when and how we might be able to get back to the office? Beth, I was wondering if this was something that you would maybe want to come in on.
I can come in briefly, yeah, and then I think Lisa's unmuted herself as well, so I'll hand over to her for the more expert stuff. I was just going to, my point was going to be around, I mean, even in level 0, the advice is still work from home where you can. So if you have been, working at home, you should be continuing to do that. I think it's moved out of regulations into guidance, but I think that, unless there's a good reason to be back in the workplace, you really should still be working at home. But what I was going to highlight was there's some resources, and there's been a lot of discussion that we've been part of through our HR service and some of our digital work as well, about what will it look like actually when we do begin to get back to the office, and how will we do hybrid working potentially is a term that's been used quite a lot, or blended models. How can we work asynchronously, which is where you maybe use digital tools to be able to share and collaborate even though you're not there in real time. So again, I'll not go into all the detail just now, but I'll pop some links up. But if you're interested in that, we've got examples of kind of flexible working policies. We've got some information on our website about hybrid working and the sorts of things that people are starting to consider, how you make that work for your staff, but how you also meet the needs of the organisation. Because I think we all recognise that there's some sort of creative activities that just don't work so well digitally and remotely, and it's really nice to have the energy of being together with people. So that's not a specific answer on the timescales of offices reopening, because I know that until we're in level 0, the suggestion is you still do that from home if you can. But as you're planning for your workforce being able to return to an office environment, there's a lot of sort of thinking around that and discussion. So I'll pop those links up. But I don't know if Lisa McCann wants to come in on the practical stuff.
Hi Beth, I think you more covered it. It's still at level 0. It is work from home where you can, but it is at that point you really should be thinking about, as you said, how do you get back into the workplace, and think about people to do it and how will you do it safely. So an example being my service is obviously a service that's continued to work, so we are predominantly based at home, but we'd still need office access and have done right the way through. But our our office capacity is down to less than a third of what we do, and it's booking in advance and things like that. So it's thinking about how do you plan to get back into the office, and how do you safely plan in the transition period as well, because it's exactly what you said, Beth, people have to think about what will be the new normal going forward, but you need to plan for that important in between time. And as you bring more people in, you need to think about, how am I going to keep them distanced, how am I going to do I need to increase my cleaning frequency, and things like how do I manage break rooms, how do I manage staff kitchen areas, and all this sort of things. Toilets, what's the safe number of people you can have in your toilet in the workplace? So a simple solution is, do you have a green red sign on the door, who can go in and out? So these are all the kind of practical things that people need to think about, not when just going back to the office, but just going up and opening up generally. So again, just practical things I've seen when I've been out and about over the past year, and sharing that with you.
Thanks, Lisa. I'm just picking up a couple of questions that have come through in the chat box and in the question and answer box, and I'm mindful that we've just got you for another 5 or so minutes, Lisa. So maybe this is one that we could maybe deal with fairly quickly. There's a question around about service users and evidence around vaccinations in order to be able to use services. So we provide community learning and development services. What guidance is available with regards to asking service users for evidence of having had vaccinations or of their testing status? Now, my understanding is that that's not something that is a requirement or in place for anybody who might be accessing a service, and that includes staff or volunteers. Lisa, I don't know if that's something that you...
Yep, I'm happy to talk about that. So I agree with you, Lisa. I'm not aware of anything about asking anybody on their vaccination status. In fact, the only thing at time I've seen that is potentially travel companies, if people are trying to, for travel, getting that back. So in terms of public services or any services or things out and about, I'm not aware of anybody asking what's a vaccination service. What people can do though when they're offering their service is they can give information to their staff, volunteers, service users and clients about reminding people about not coming into work or coming to the service while they've got any one of the cardinal COVID symptoms of a temperature, cough, loss or taste of smell or taste, and that they should self-isolate and seek testing as appropriate. That they can look at. Organisations can look at a testing programme. A few weeks ago, it was announced that everybody can have access to the lateral flow testing, but it's not something I can see that people could make mandatory. That would go into employment law, so that's out with my scope of expertise. But it is something people can consider, and if people were considering it, I would actually recommend that they contact their local health protection team in their own health board to get advice, because if you're going to do that, you actually want to make sure that you're doing it in such a way that it's getting done and it's getting quality assured. So you're actually getting that, and I see Mick's trying to come in just now as well.
Yeah, I mean, I can absolutely understand why people think that this is a possible solution, but there's obviously a bit of a debate about this in the country because it's got human rights dimensions and other issues around access to services. I see Claire saying that her insurance company has raised this as a requirement regarding vaccination. We'd be really keen to hear about that and try and figure that out in terms of which company it is and what's the basis of their analysis, because at the moment I just don't think that that's something that is permitted. And the guidance that Beth is published may have some further views around that, and she's put that in the chat. So it'd be great to hear about that, and I think we need to just take that under advisement and have a think about it and try and give you some accurate advice rather than shoot from the hip on it. But I agree with what everyone's said so far.
Yeah, absolutely. I think that particular point is one that we would definitely want to follow up. So we'll pick that up after the session, if that's okay. Just very, very quickly, just maybe as a final question, whilst we have Lisa with us, there's a question being posted in the chat around about the responsibilities for people who are managing or rather who are using community facilities. We've got a question from someone who is part of a committee for a community centre, and what they do is the groups that are using their space, they are already, cleaning down surfaces, cleaning down touch points, etc. But they've got a question about, well, where do you draw the line between what is reasonable to ask people to do and what, you might need to put some measures in yourself around. So, for example, cleaning of bathrooms and toilets. So, I mean, I'm sure that that's something that quite a lot of people will be able to relate to. Probably what I would say around that is that if you are managing a community facility or a space and you've got people who are using that space, then it probably isn't going to be any different in terms of the responsibilities to what you would already expect them to do. So if people are already expected to clean the bathrooms, clean the toilets, clean the communal spaces as part of their agreement with you, then it's really just about putting in a schedule to make sure that that's done more regularly. And we'll maybe, you know, we can signpost you to some information about that in the Supporting Community Safely resource about how you put a schedule in for cleaning and disinfection. But I wondered if, Lisa, if you had any, you know, last minute thoughts before you have to shoot off on that.
Yep, not a problem. I think it's definitely a pertinent question. If I was organising that, I would have what I would have done beforehand. So what was my normal cleaning as the person responsible for, or the group responsible for the building, and what was I doing? And then you need to clearly communicate with your people that are renting your space or using your space, the expectations from them and from you, and so there's understanding on both sides. But exactly what you said, Lisa, making sure that there's a schedule there and an agreement. What I would maybe do is have somebody monitoring as well, because depending on the types of groups that are using it, you might want to be able to know, are they able to do that? Because do they have enough capacity to do that, as well as depending on their service users and things like that. So I think it's a lot to do with the dialogue between the different parties involved, and then just coming to the agreement that suits everybody. But as a minimum, if you're the ones organising and running the hall, you'd be making sure that when the hall is handed over to a group for its use, that it was in it was clean to state that you would expect to use it yourself. And then obviously it's a matter of working with your people that are renting your space, and then monitoring and checking and tweaking things as they go.
That's great, Lisa. Thank you very much. We do have some questions about ventilation in particular, but as I said, we can pick that up in the presentation that we'll come to a little bit later. I think we're out of time pretty much for questions. I do appreciate that there are a number probably posted in the chat there that we've not managed to get around to, but we'll try and pick them up through the remainder of the session if we can, or we'll come back to folk afterwards around about that. So I'll maybe just hand back to Beth at the moment, if that's okay.
And I'll just like to say thank everybody for having me, but I've got to jump off to my next meeting, and wish you well for the rest of the session. Okay, thank you. Bye bye.
Great. So thank you very much, and a special thanks to Lisa, although she's just jumped out. So what we were hoping to do, as Lisa Martin said, we will try and get answers for all of these questions if we haven't been able to get to them in time, and we'll either send them to you individually, or we'll kind of collate the best links and get them out to people after the session. What we're going to do, I'm aware we've been on for an hour, and for some people that might be enough Zoom time, so we would understand that, but what we'd really like to do is to get into the detail of the resources that we've flagged up and mentioned a whole load of times so far, and Mick and Lisa have got a more detailed presentation that will take you through really practically some of the stuff, particularly around ventilation and occupancy levels. So if you can stay with us, that would be great, and I'll hand back over to Lisa, and we'll get into some of that detail now. So back over to you, Lisa, I think, is that right?
Thanks, Beth. That's absolutely grand. I'm just going to ask Mick if he wouldn't mind sharing the screen for the slides. Just wait a wee second for that. What I might do, if it's okay, is I'll just pop my camera off whilst these are up, and that means folk can just kind of look at the information. So I'll pop this off just now.
Okay, can you see that?
That's brilliant. Thank you so much, Mick. That's grand. So, so we've talked about the Supporting Community Safely resource a number of times already, and hopefully some of you will be familiar with it. But for those who are not, just do a very brief introduction, and we'll cover some of that new content in a little bit more detail, and Mick will go through that in a second. But just to give you a little bit of background, if you could just flip on one slide, Mick, that'd be grand. Perfect, thank you. So the Supporting Community Safely resource is a joint piece of work between the Scottish Community Development Centre and Public Health Scotland. We launched it in May last year. It was really a response at the kind of early stages of the pandemic, and it was after lots of conversations and input from partners like SCVO, and others like Ready Scotland, the Scottish Government, and also from communities and groups who were either already providing or that wanted to provide an emergency aid response, but maybe didn't know how to go about it, or they weren't finding their way to the information that they needed. So the original pages on the resource focused really strongly on signposting, on summarising and simplifying the formal guidance, and that was really just still emerging in those early days, and giving people really practical advice on how to put policies and procedures in place that were going to be in line with the key public health and government messages on infection control and keeping people safe effectively. So, this was all in the early stages, really at the height of the pandemic. But as we moved through the year, guidance for the sector started to emerge. We had various changes to the restrictions and the lockdowns. So we revised the pages as were needed. And the most recent and relevant change is the new section of the resource, which is Part A, which is about restarting your services safely. And that's what Mick's going to concentrate on just shortly. So when you open the link to the Supporting Community Safely resource, the landing page will take you to a menu, and it's set out in the two sections that are shown in the right-hand box here. So Part A, as I've mentioned, is the newest content of the resource, and it focuses around starting back safely, as I said. So it's about what services and activities can reopen. It's about thinking about why you should be reopening. Is it the right decision, or is it safer to carry on maybe remotely for the time being? When is the right time, and how to do it safely? And it really, I think Beth's mentioned this a number of times, as has Mick, we've really kind of majored on giving people really practical kind of functional advice and resources and tools that they can use to apply to their own particular situation and setting. So Part B of the resource is mainly the original content, and that's really those kind of key messages from the height of the pandemic, but that are still equally important now, reducing infection transmission and integrating that message into all of your policies and practice. It's really about how do you kind of operationalize that, and how do you make it part of your everyday procedures. So if we could just flip on to the next slide. So whilst we're going to hear from Mick just shortly about the Part A section, we wanted to just remind people not to forget the basics, and that's those key messages that are covered in Part B. So firstly, there is a really comprehensive section on hand hygiene. It gives you all the information that you need. It gives you the detail that you would need, for example, to create your own posters, your own signage. It has videos there around hand washing and how to use hand sanitizer properly. Those are things that could, for example, be used as part of, staff or volunteer training. It basically explains why hand hygiene is still so important and how to do it properly. The section on cleaning and disinfection is equally comprehensive. It covers how to put a system in place for different situations. So for example, whether that's a base or premises, a physical building, or whether you have minibuses or vehicles, or if you are visiting someone's home. That would be if you were providing an essential service, as we explained earlier, for example. Not much has changed around face masks since the summer of last year. They are still required in all indoor public spaces. That does include community settings. If it's a non-public facing space, like a back office, for example, they can be removed at your workstation or desk. But for moving around the kitchen, going to the toilet, going in and out of the building, they have to go back on again. The section on face masks gives a current list of the exemptions for wearing them and who that applies to. So that's also, really important information. The test and protect section is probably the most important bit of our kind of don't forget the basics message. And that's really because, rapid, accurate contact tracing is still at the heart of managing any outbreak. So the pages here highlight your responsibilities around contact tracing in particular, and they advise you how to put your own system in place. That links in very closely with what we've already covered around risk assessment, and there are links in that section around important guidance. One of those is around the Safer Workplaces guidance. That's for employers, and many of you will, of course, be as employers as well as providing services in your communities. There's two very quick points that I just want to touch on about Test and Protect that we've not managed to get up on the resource pages yet, but we will do so in the coming days, and I wanted to bring to your attention. Lisa McCann already mentioned these, but just to reinforce it, the first is about contact tracing. A lot of that has gone digital now. You know, if you're out at a cafe or a restaurant, then what you'll almost always have to do is to, you know, log into a smartphone app and you'll scan a QR code at the door. That logs all of the details of your visit and you don't have to do anything else. That system isn't just for hospitality or retail. As Lisa said, any venue can register on the system. If you go to the mygov.scot website and you search for Check-in Scotland in their menu, you'll be able to find all the information you need about how you register your premises and what the requirements are. Now, we know that is not going to be a system that is going to work for everybody. Lisa mentioned this earlier, you know, not everybody has access to a smartphone or is confident about being able to use a smartphone. There are people in rural areas who might have unreliable Wi-Fi. And that's absolutely fine. You can still have a manual system for recording all of the visitors to your premises or the users of your groups, or you can have a mixture of both. It's just an admin and sort of time-saving option that you might want to look at. And just the second thing I wanted to reinforce was the point that Lisa also raised about asymptomatic testing. This is something that has been introduced over the last 3 or 4 weeks. Anyone in Scotland now can order home testing kits for themselves and for their families. The packs provide 2 home tests per person per week. You can pick them up from a local testing centre or you can have them posted to your home, and that's absolutely free. And again, maybe just that point that was raised in the question and answer session, it is completely voluntary. You know, we can't make it a requirement that anybody completes asymptomatic testing. But at Public Health Scotland, we are really keen to raise awareness of it. We can post a link in the chat box to the website where you can find out more information and where you can get the testing kits. But we would be keen if organisations like yourselves would use it as an opportunity to just raise awareness amongst your staff and volunteers, but also the people who are using your services, and maybe signpost people to that link as well. So just the final point was about physical distancing, which I'm not going to touch on because Mick's going to pick this up in the next few slides. You know, in part B, we had a lot of information about physical distancing, but we've really kind of enhanced that in the new pages and the new content. So I'll just hand over to Mick now for a run through of that and what else you can find in the part A pages. So over to yourself, Mick.
Thanks very much. And this is a wee bit of an experiment because I'm going to try to use some recorded sound, which is a better way of stopping me rambling on in the long term. But I'll see how that works and I'll run through some of these stuff. It's not a substitute for looking at the resource because the resource has an awful lot of information in it. And I can't cover everything in the presentation, but I'm just hoping to raise some of the key points and let you get a sense of where we are. So here we go.
So the section of supporting communities safely, dealing with starting back, was actually published initially in December, and it has been amended now with some new practical advice. But quite a lot of the resource helps to support your decision making in terms of summarising the government frameworks, guidance, the route maps, all of that sort of work, and helps you to think critically about whether or not this is the right time to restart or whether there's another way to carry out your work. Ultimately, it's about helping you balance the risks and harms of COVID against the risks and harms of not being able to deliver a service, and also to transfer all of that into a tangible risk assessment that you can share with others. All of that information is in the early sections of section A of the resource. So as I say, the resource will help you with the initial planning and thinking about risk and how to avoid it. It will then help you break down some of your thinking into issues associated with your building, issues associated with the type of service that you're trying to deliver within your building and its implications for COVID safety, and implications associated with the needs of the people who are using your service, and how all of these things interact to provide you with a kind of integrated, holistic assessment of risk in your service. It then goes on to advise on how you need to liaise and work closely with other people who might share a building and where you can get assistance to put your risk assessment in place. And then ultimately, it helps you to review and reset whether things are working and keep an eye on that and change direction if in fact that becomes necessary. So these new key messages that we're launching this week try to deal with the current context, which, to put it in a nutshell, is that things are much, much better than they were at Christmas time and when the last lockdown started. But we're clearly not quite out of the woods yet, as the situation in Moray and other parts of Scotland may be beginning to suggest. But we know that people desperately need the services that you provide, and we want to help you get back to providing them as soon as it's safe to do that well. As part of that, we've reminded you that outdoor space is always better at the moment, and hopefully in the spring and summer there'll be opportunities to carry out more activities outside. But that planning for the use of indoor space is possible if you're systematic about it, have a basic understanding of some of the scientific principles, and are able to use this to plan to keep appropriate physical distance. So overall, it's a story of vaccines, which is very positive, and variants, which we have to continue to be careful to watch out for. It's a story of ventilation and the value of fresh, clean air, and it's about vigilance in our physical distancing, so that we don't just pay a theoretical commitment to keeping apart, but actually do everything we can that is possible and practical. There is lots of excellent guidance and advice available to help people deal with COVID, whether it's from the Scottish Government, the Health and Safety Executive, the NHS, or many other sources. We've tried to link and signpost you to lots of that guidance in our own pages, and our advice is that you should take the time to read it and try and understand what it's saying. However, many of you have also told us that you could benefit greatly from some clearer advice on how to put into practice some of the things that you've been advised in the guidance. And we've tried to do that in these pages using visual images and languages as plain as we've been able to make it. The other thing we have been asked about and have tried to develop are some usable tools, and as a result of people trying to struggle to put into place some quite complicated thinking. So we've done our best to produce a number of calculators that help you to calculate various aspects of the physical distancing numbers in a simple way by putting in simpler measurements, for example, of the area of your building. And we've also shown you how to work out the area of your building in a very practical way within the pages. These new sections deal primarily with two issues. One is safe use of space in a way that allows people to physically distance from each other at 2 meters social distance. And the other is the importance of good, fresh air flowing through a building in reducing the concentration of the virus itself. In terms of space, we talk you through how to think about the layout in your room and whether there is anything you can do to make creative use of things like exits to keep people as separate as possible within your building. And this is part of, in a sense, kind of limbering up about how you might do the space planning and input that into your risk assessment. Measuring the area is key, and we don't want to assume that everybody knows how to do this, and we provide some advice about how to measure the area of sometimes awkward spaces in order to be able to calculate the physical distancing limits. We introduced the idea of static and dynamic spaces, which are basically spaces where people are still, like a meeting or a classroom, and others where people require to move around a little bit more, like in a food bank or in an engagement event or in a yoga class. And there's a difference between the numbers of people who can use buildings in each of these contexts, and the resource will explain that and the underlying science as simply as we've been able to do that. And thanks to the Institute of Place Management, an academic partnership based in England at Manchester Metropolitan University, who've assisted with this. This is key in terms of knowing how that limits the numbers who can safely physically distance at 2 metres in any room, and that has practical implications for physical distancing. In terms of the ventilation issue, the key thing is that understanding how your air quality is within a building matters, and we'll tell you a little bit about how to do that, and also an understanding of the importance of ventilation and how a free flow of fresh, clean air is really important in stopping concentrations and build-up of the viral particles that can make people ill. So the resource covers the following issues about ventilation. We explain how fresh air radically reduces risk, and that's connected to why working outdoors is good wherever you can do that. What you need to think about is how ventilation can recreate this supply of good air indoors. It's most straightforward. It's about opening doors and windows, and it's also about airing out rooms in between sessions so that there's no build-up of stale air. Monitoring air quality helps, and we show you how we're using a suggested method for measuring carbon dioxide. And very importantly, we encourage people to understand their own ventilation system in terms of what it can do and what it can't do, because this is vital in terms of how well it will be able to support good ventilation and therefore COVID safety within the building. So we're talking here primarily about mechanical ventilation, fans, air conditioning units, etc., but also how that works alongside the natural ventilation of doors and windows. And critically, we emphasise that this is a highly skilled and technical area that you can't really just work out for yourself, and that you need to maybe get access to some assistance. And we would strongly recommend that the sources of advice and help that we signpost you to are used to ensure that you get public health advice from environmental health teams if you need it, but also the technical advice from specialist engineers on how to service, maintain, augment or upgrade your ventilation system. So you really need to be reading the pages of the resource to make sense of all advice and instructions, but if you were, you would be able to do the calculations necessary to work out how many people can use your spaces safely at 2 metres social distance. Here's a drawing of our offices. This is a real drawing, the only one I could find during lockdown when I wasn't in the office. You'll notice it doesn't contain sizes, and you can ignore the dots because they were actually there to indicate where we were going to put the new computer points in one of our office refits. However, I have used it as a starting point, and it's helped me to think about the fact that there's a number of doorways in our office. We've got a strange setup, we've got 3 doorways, and that allows us to think about a couple of things. One possibility is whether we can put in place a one-way system to use the corridor, since it's not terribly wide, or whether we could actually use that to turn our offices into 2 or 3 separate bubbles where people could use a separate door to use part of the office, and it would be like having 3 COVID-safe offices within one office. So the next thing I notice is the meeting room down in the left-hand corner of the diagram is an irregular shape, so it has a bay window, quite a bit of space in that. In measuring up that space for COVID-safe use, we have to do a calculation that involves the length times the breadth, giving us the area for a straightforward rectangular space. So just to get us started, I've taken a rectangle within that room, and I've also taken a simple rectangle at the other end, and I've had the space measured up. And I know that roughly the office is 7.5 metres by 4.5 metres. If we multiply those together, we get 33.7, and I've rounded that up to 34. And in the other meeting room, it's 7 by 3 in the rectangular space that I've chosen to measure, and we will see that that comes to 21 metres squared. So we've used the metre squared figure, which is the area figure, in a calculator we've been developing along with the Institute for Place Management, who are based in Manchester University, but who have collaborators in Cardiff and other parts of the UK and internationally. And they've helped us to produce a calculator which we can hopefully share with you soon, where all you need to do is to put into that the area of the space you're looking to assess, the social distancing limit, whether it's 1, 1.5 or 2, and the kind of space it is. So is it being used for static activities like meetings or displays, or is it being used for active activities like food banks or yoga classes, or things where people move around? Because it does make a difference, and the resource will set out the amounts of space you have to allocate per person for these different contexts to make a room safe. So in this context, our meeting room, if it's a straightforward meeting, we can accommodate about 5 people in that space roughly. But if it's
Mick, I think we've lost your presentation.
What's happened there? I'm just getting it back in. I beg your pardon. Can you see it again?
Yep.
Sorry about that. I'll rerun the last slide and just run it on to that part. I seem to have lost my screen and I don't know why.
Okay, can you just talk to the final part of it then? I think you were close to the end, weren't you?
Sorry about that. So yeah, I mean, what we are trying to do with this is a rough version of the calculator. I was almost finished explaining it there anyway. So it was, we're still working on the calculator. We're still looking at revised Scottish Government calculations that seem to be on the way as well. But the purpose of it is you can't put too many people in a space and expect them to be able to social distance at 2 meters. So the purpose of the calculator is to give you an easier way to put a measured space into a calculator that does the complex maths involving pi r squared and what speed people move around at, and gives you a guide for how many people can use the place under specific kind of contexts. And we've tried to do that, and we've also tried to do another thing where, to make that work in practice, there's another website on the site, which is a free website, which allows you to sort of draw your room, having done the calculations, and just see how it works in 2 and 3 dimensions, and produce a bit of a floor plan and check that everything checks out. You can actually get the people in that you say. And if we have got time, I can demonstrate that in a minute. But sorry about the PowerPoint, I wasn't nearly finished, and I don't quite know what the problem is there. Some technical gremlin, I'm afraid.
No problem, there's always technical gremlins, isn't there? We've only got 3 minutes left, so I'm not sure if we'll have time for your final one, Mick. I think we're probably running close to the end. But I think we've covered, hopefully for people, a huge number of the questions that people had, and some of the really practical information. We have taken away the questions we weren't able to get to, so as I said before, we will try and get answers out to them, and we'll be sharing on PowerPoints after the event, and we'll share links to Mick's very effective, I thought, kind of talking over your slides and keeping yourself on time. I might copy that for a future presentation myself. So it just remains to say thank you very much. Thank you very much to Mick and Lisa. Thank you to Lisa McCann, who had to leave us early, unfortunately, but I hope you've got a lot from that. And please do get in touch either with us at SCVO or with Public Health Scotland or SCDC if there's anything else you want to flag up, you think we've missed, you think is important, or other resources that you think we should be sharing. We'd be happy to hear that, as well as the questions that we've picked up today. So good luck with it. I hope you're all able to reopen. I hope we can get back to some kind of face-to-face activity soon, and in the safest way possible. Remember not to hug each other until we're allowed. So yeah, best of luck with it, everybody. Thank you very much. Bye.